Are you struggling in doing Padmasana? Well, I am going to help you how to do Padmasana. Namaste, welcome back to my YouTube channel, Yoga Shala. In this video, I am going to explain you how to do Padmasana, and as well as I am going to explain you what exactly you have to avoid while doing this Padmasana. Okay, so now you look at the camera, you extend your both legs forward here. Okay, you sit in simple cross-legged position. Now, the moment when you are doing the Padmasana, make sure that all the movements should be happen from the hip joint, because when you go with the Padmasana, most of the movement will be happening, not only the Padmasana, if you are doing any asanas, the movement should be happening from the hip joint. If you are doing the back bend, the movement should be from the hip joint only. If you are doing the splits, movement from the hip joint, right? If you are doing Padmasana, movement should be with the hip joint, right? So when you are going with the Padmasana, the main movement should be happening from the hip joint, okay, because your hips will play an important role in doing all the asana practices in the yoga. Okay, so here I am going to explain you what exactly to be done while doing the asana and what exactly you have to avoid while doing the asana. And the moment when I am showing you, please try to zoom the video and you please try to observe and where exactly you have to focus when you are doing the Padmasana. Okay, now you extend your both legs forward, you sit in simple Dandasana, extend your both legs front. Okay, make sure that posterior part of the legs are touching to the ground comfortably, and you are touching your both the sitting bones on the ground. And if you are new to this practice and if you are finding difficulty in Padmasana, you can take a blanket and you can sit on the blanket. If you are finding difficulty in sitting on the ground, that's fine, no problem. And one thing you have to remember, when you are doing the Padmasana, see, like everyone thinks that when you are doing the Padmasana, they are lifting the leg up and keeping his leg on the thigh. When you check, they are lifting the leg, they are twisting here. Well, it should not be done when you are doing the Padmasana. See, the moment when you are doing the Padmasana, movement should not be done from the knee. See, why I am telling why the movement should not be done from the knee, here is the maximum rotation should be done from the hip joint, right? When you check the position of the knee, now see, this knee will move front and back. Okay, we can't twist it, right? If you are twisting the knee, we can't twist the leg when you are doing the asana, right? So the movement should be done the front and back. Here I am extending and I am flexing, right? So when you check the door, just we are closing the door, we are opening the door, we are closing the door, we are opening the door. See, there is we are closing. We are not rotating the door, right? And whatever how the doors plays, the role in the same way your knees also plays the same role as the door. Okay, here I am opening it, I am closing it, right? It should be done when you are doing the Padmasana. So one thing you have to remember, that when you are doing the Padmasana, make sure that you have to fill the gap between the hamstring and the calf. There should be no gap present between your hamstring and the calf. You have to fix it completely. You have to fill the gap completely. That is the first thing that you have to do when you are doing the Padmasana. You need to remember that when you are starting the Padmasana, make sure that you have to concentrate on this gap, whether it is filled or not. If it has filled, you try to fill that gap between the hamstring and the calf. Okay, now simply bend the leg and just try to touch your heel to the perineum here and simply stay there. Now very slowly you drop the leg. The moment when you are dropping the leg, now see the movement is happening from the hip joint. Movement is not happening from the knee. When you check this gap, the gap is still closed, right? And the knee will remain the same, but the movement is happening here. Now see, this is the movement of the hip joint. The moment when I am dropping, now automatically I am getting the rotation, getting the movement from the hip, not from the knee. That is the one thing. And the moment, as we are doing the Padmasana, it is very important that you have to bring this leg on the thigh, right? Most of the people will do that, they are lifting the leg, they are twisting and they are keeping. No, it should not be done. In order to twist this knee, is simply, if this is the position of the leg, where my heel is touching to the perineum of my thigh, like perineum of my one leg, okay. Now see, when you check here, the gap is completely filled, right? Now simply, your knee will remain the same position. You have to go with the movement of the hip. I want to tell you why the movement of the hip, because all the external rotation will happening from the hip joint. We have the ball and socket joint, right? Now this is the socket, this is the ball. The movement will be happening from this ball only, right? From this ball only, right? So here, this is the leg. Like you have to assume that, as you have to assume that this is the kind of bar, this is kind of ball, this is your hip joint, whatever the gap here, this is the socket, right? We are fixing this leg. Simply we have to say that we are fixing the legs to this. And the movement should be done from here only. Like we can't do the movement from the knee. Clear? So here you have to go with the movement of the hip here. You simply hold the leg. Now hold the knee with the one hand, ankle with the other hand. You simply move this leg front. Okay, you have to move this leg front. You lift the leg slightly. Again you move the leg front and simply keep your leg here. When you check, the gap is still filled. I'm not straining my leg unnecessarily because most of my students are finding difficulty. Like I got so many comments that everyone are finding difficulty while doing the asana there because they have the knee issues, they have the ankle issues, they have there's so many problems they have. You no need to worry. The moment when you're following these points, if you have to follow these major points, you can't find any difficulty when you're doing the asana, right? But if you have the severe knee pain, then you don't strain unnecessarily. You have to take some precautions when you're doing the Padmasana. So the moment when you're doing the Padmasana, if this is the position of the leg, you simply hold the leg with the one hand. Still my knee remains the same. Now you hold the knee with the other hand. You simply lift the leg slightly up. When you check again, my knee will remain the same. You just simply move the leg front. When you check, again the knee will remain the same. But the movement is happening from the hip joint. And simply you keep your heel to the abdomen and you try to keep your ankle on the top of the thigh and stay there. And one thing you have to remember that most of the students, those are finding difficulty, and they will do the common mistake that when you're doing the asana, of course they are following the same, but don't keep your ankle on the top of the knee, the behind the knee. If you're keeping this leg behind the knee, we can't move the leg because it will restrict here. Okay, this ankle will stop the movement of the knee. Okay, we can't flex. We can't. Of course we can extend, but we can't flex the leg, right? So instead of keeping this ankle on the top, you remember that you have to move this leg front and simply you try to touch your heel to the abdomen and you simply keep your leg here. Alright? And one thing you have to remember, you please don't try to bring the other leg while this knee is completely higher. You remember, you need to push the leg down completely. You have to go with the external rotation of the hip joint here, automatically it's happening here. So you just keep pressing the leg. Still, if you're finding difficulty in dropping the leg down, you can use the cushion, you can use the blanket and simply keep the blanket under the leg and simply you can do the asana. And the second step, that if you want to bring this leg, so I can bring this leg very easily because I'm quite flexible, right? So the moment when you're doing the asana, you drop the leg down, don't fix the leg, don't try to keep your ankle in the dorsey, you simply relax it, okay? Make sure that your hamstring muscles and your calves are completely relaxed. When you're bringing the leg, this is the left leg. When you're bringing this left leg to the right thigh, make sure that your complete leg is relaxed. Don't try to go with the full extension of the leg. Clear? So further you keep leg in the plantar and simply drop the leg down. Here I'm bending the knee slightly. So there should be no muscle restrictions. You can't, your muscles won't restrict you when you're doing the asana. If you're flexing the leg, if you're going with the dorsiflexion, when you check, the complete posterior part of the leg is touching to the ground, right? We can't bring the leg because your leg is in complete full extension, right? Then you will get the too much restrictions when you're doing the asana. Further, you keep your leg in the plantar and drop the leg down very easily. Now for that, if you want to bring the leg, you simply shift the weight to the one side, okay? And very slowly, you bend the leg and try to bring this leg here. When you check, again I'm filling this gap between the hamstring and the calf. Okay, I'm not making the movement. We are not doing any rotation of the legs here. When you check, it is completely filled here, right? Now what you have to do, you hold this leg with the one side. Okay, as simply now see, this is the position of the leg. Now when you check, the moment when I'm keeping my leg under the thigh, now see, I'm filling this gap completely. No movement in the knee here. Okay, now simply you try to bring this leg back and try to flex the leg. Just try to go with the dorsiflexion of your left leg. Now very slowly you hold the feet to the one hand and very slowly try to lift the leg up. Okay, and simply you try to, when you check, you have to concentrate on the gap here. Now see, when I'm bringing this leg up, make sure that there should be no too much gap, there should be no gap between the hamstring and the calf. It should completely fill. Okay, you have to lift the leg. Now see, it's completely filled. The moment when I'm bringing, see, I'm not changing the movement of the knee here, right? You please try to concentrate that don't try to overextend. Most of the students will do, they're lifting the leg. No, you're straining unnecessarily. No need, it's very easy to do the asana. So this is the position of the leg. Very simply, you touch your heel to the shin here and very slowly you check the movement here and very slowly you have to bring the leg and simply you keep a leg here and try to bring the leg front and you can stay there. And if you are the beginners with the practice, of course you will get the gap between your thigh and the ground. That's completely fine. You can use again other blanket under the leg and simply you can do the asana. If there's too much gap, you can use the brick under the thigh and simply you can stay. But please don't overstrain your knee unnecessarily when you're doing the asana. Okay, you don't need to lift the leg completely from here. You don't need to lift and don't cut the leg. No need. You simply hold the leg very easily without disturbing the position of the knee. You simply raise the leg and keep the leg on the thigh. So the main movement should be done from the hip joint, not from the knee. So always remember when you're doing the Padmasana, in Padmasana the movement should be happening from your hip joint, not from the knee. You please don't disturb the knee unnecessarily when you're doing the asana. Okay, so you have to go with the hip joint rotations. Okay, the moment when you're doing the Padmasana, when you check, this is the Padmasana. Just assume that I am a beginner. So I'm lifting the knee here. Okay, so when you check the position here, now see, maybe sometimes you will get too much pain exactly here. Okay, and sometimes you will get little pain in the knee as well. Okay, so for that you need to hold for some time and you can relax. Because if you are new to this practice completely, definitely as we are going with the too much knees flexion, right? And chances of getting little pain if you have very tightened hamstrings, because there are some cases. One thing you have to remember, like if you are still if you are able to do the Padmasana, but still if you are finding or if you are struggling in holding the asana, there is some reason. If you are struggling doing the Padmasana, one thing is if you have very tight hip joint, then we can't do the asana, because if you have very tight hip joint, then we can't get the movement of the leg, right? We can't get the movement of the hip joint. We can't do the external hip joint rotation when doing the Padmasana, because the main role is your external hip joint rotation, right? So if you have a proper hip, if you have very proper hip mobility and the flexibility, then we can keep the leg very easy in the Padmasana. So we can do the Padmasana easily. So before doing the Padmasana, if you are struggling in doing the asana, you need to remember that you should have a proper flexibility in the hip joint. Okay, that is the one thing you have to remember. And the second thing is like if you are struggling in doing the asana, and if you are finding difficulty in holding the asana for a longer time, if you are getting pain and if you are struggling again, still you are finding difficulty, that is because of the too much tightness in the hip joint, because of the tightness in your hamstrings and the calf muscle. And of course, if you have very too much tightness in the quadriceps, it won't allow you to do the asana. Of course, your quadriceps also plays an important role, and your hamstrings also plays an important role. If you have very tightness in the hamstring, and then you can't bring the leg back. So we can't flex the leg properly when you're doing the Padmasana. So the moment, if you are getting this difficulty while doing the asana, better you have to go with the flexibility, everyone. Okay, so you have to go with the proper hip opening. Because the hip opening will play an important role in doing the Padmasana. So better you focus on the hip opening exercises, so that will helps you in doing the Padmasana. And most of the students will find difficulty, and most of the students will find the same difficulty, when they are doing the Padma, when they are doing the Shirshasana, when doing the handstand, or the whole Vrishikasana. And there are some advanced poses, if you are in the Shirshasana, if you want to do the Padmasana directly. So because of the less hip opening, then we can't do the Padmasana directly, because your hamstrings, your hip joint will restrict you directly. And if you are sitting on the ground comfortably, if you are able to do the Padmasana, it's fine. Your hips are quite flexible. Okay, but when you're doing the advanced asana, like if you want to do the Padmasana and Sarvangasana, if you want to do Sirsasana in Padmasana, if you want to do Padmasana and Sirsasana, there you may find difficulty. So better you have to focus on opening of your hip joint, so you can do the asanas very easily. Okay, so whatever the points I covered, you please try to follow these points when you're doing the asana, so that you can't find difficulties. You no need to worry that if you have knee injuries, if you have the knee pain when doing the asana, it's kind. If you are getting the pain because of over rotation of the knee. See, rotation can't happen from the knee. Clear? All the rotation will be happening from the hip joint. So make sure that you have to do the movement from the hip joint. If you are finding difficulty in doing the movement from the hip joint, so better you have to go with the drills. You have to go with some basic asana practices, so that which will open up your hip joint. And the second thing you have to remember, that when you are doing the asanas, make sure that the position of your both the thighs are touching to the ground comfortably. And if you are finding difficulty, you can use something under the leg. See, I'm still having the beginners stage, right? So you remember that you can use the a blanket, you can use the bricks, you can use the pillow, so that will support you and you can't get that much strain in the knee as well. And if your knee is completely up and sometimes you will get the pain because of because of the tightness in the hip joint, the hamstring, you may get, that will give an effect on your knee as well. Okay, because here the joint, here the nerves are completely connected to the knee as well, right? And if you have very too much tightness in the hamstrings, so chance of getting the pain in the knee as well. So better you can use something here, so that will give a proper support, so you can't get that much pain in the knee. So that's the one thing you have to remember. So the other thing is, you have to remember that you just don't try to hunch in the back when you're doing the Padmasana. Make sure that your spine is completely lengthened. Okay, so here both the sitting bones are touching to the ground comfortably, but still if you're getting difficulty, you can use the pillow and you can sit on the blanket, so you can't get difficulty. And maybe everyone thinks that Padmasana is very easy, so we can do the Padmasana. No, like everyone thinks that Padmasana is easy, but Padmasana is not easy. That you have to remember when you're doing the Padmasana, make sure that your both sitting bones are touching to the ground comfortably, and just try to you need to lengthen the spine, and you have to stay here. You can keep your both the legs. You need to keep your both the hands in the Chinna Jnana Mudra on your knees, and you have to lengthen. Don't squeeze the shoulder. Just try to rotate the shoulders back. You try to lift the sternum slightly up, where you're making making the small lengthening in the spine. You just don't try to make too much arch in the back. Here simply you have to keep your neutral spine and the natural spine when you're doing the asana, and simply you have to close your eyes when you're doing the asana. Okay. And the third thing that you have to remember, when you're doing the Padmasana, make sure that both the quadriceps are completely engaged when you're doing the asana. If you are going with the engagement of your quadriceps, so that actually prevents your hamstring from the pain. Okay. And the third thing, that when you're doing the asana, that you please keep engaging the glute muscle as well. Okay. It also plays an important role, as this is the glutes, right? Because it's connected to the hip joint, and the hip joint is the movement will be happening from the hip joint. So you keep engaging the glutes, so that will stabilize your body. Okay, when you're doing the asana. And sometimes most of the people will get the pain. They will get the back pain when they are doing the asana. If they are holding the asana for a longer time, and they will start getting the pain in the lower back as well. So for that, you keep engaging the glute, and as well as you keep engaging your pelvic floor muscles. Simply you can go with the Mula Bandha. Okay, so the moment when you are going the Mula Bandha, that actually activates your pelvic floor muscle, you can go with the engagement of your pelvic floor muscle with the Mula Bandha. Simply it will lift easily, and simply you can go with the engagement of your pelvic floor muscles. Okay, and the pelvic floor muscles will actually support to the asana when you are doing. And the second thing you need to remember, that you please don't try to relax your abdomen completely when you are holding the asana. Make sure that you have to go with the engagement of your abdomen, engagement of your core muscles. Okay, that you have to go with the engagement of your transverse abdominis. Okay, so if you are going with the engagement of your transverse abdominis, that will support your lower back as well, so that you can't get that pain, because you have to lengthen. If you are completely beginner to the yoga, we can't sit in this position completely for the longer time, right? So for that you can go with the Mula Bandha. Simply you can go with the Uddiyana Bandha as well. Uddiyana Bandha is nothing but simply you are going with the moderate contraction of your abdominal muscles, and that is we are going with the core engagement, so that actually supports your body when you are doing the asana. And don't squeeze the shoulders when doing the asana. You just try to relax the shoulder, you roll the shoulders back, you just try to open up the shoulders, open up the chest, and simply you can close your eyes in the Padmasana. If you are new to this channel, you please subscribe to my channel, and you please press the bell icon so you never miss an update. Here you will find all the benefit of the yoga. You will find all the different kind of asana practices, how exactly to be done, what exactly the muscle engagement when you are doing the asana, what is exactly the position of the body when you are doing the asana. I will be sharing all these beautiful yogasana practices in my YouTube channel, so you please subscribe to the channel. Don't forget, it is not only my channel, it's your channel. You please subscribe my channel so you never miss an update. Namaste. We'll meet in the next video.